A new Australian study has found that male circumcision can act as a surgical vaccine against HIV.
Now, 3 clinical trials, those done in Uganda, Kenya and Orange Farm right here in South Africa, show consistent results that male circumcision does indeed reduce the risk of HIV for circumcised heterosexual men.
Is that circumcision reduces the risk of contracting HIV. That is the evidence we have. It reduces the risk by up to 60%.
Circumcision can help prevent STDs, bladder infections, penile cancer. Male circumcision reduces rates of cervical cancer for women. So there!
You may have heard claims that circumcision has health benefits, particularly that it reduces the risk of catching sexually transmitted diseases. Let's investigate the claim that circumcision reduces the transmission of HIV. Male circumcision is the removal of the penile foreskin, the retractable sheath of skin covering the penile glands. Often branded a useless flap of skin, the foreskin is actually a double-layered roll of tissue. The outer foreskin, a continuation of the penile shaft skin, transitions into the inner foreskin, which is composed of smooth mucosa.
What does circumcision have to do with HIV transmission? The mucosa of the inner foreskin has a thinner keratin layer than the shaft skin and penile glands. Keratin is the tough protein that makes up nails and hair, so it is speculated that the lack of this substance allows HIV to enter this tissue easier. Additionally, it is also hypothesized that the immune cells in the inner foreskin, called Langerhans cells, mediate HIV's infection of T cells. So, in theory, removing the foreskin would limit HIV's point of entry on the penis.
3 African randomized control trials seem to support this hypothesis that circumcision reduces HIV risk. In one study, published in 2005, 3,128 uncircumcised South African men were randomly assigned to either the control group or the intervention group, with the men in the intervention group getting circumcised. After following up with the groups after 3, 12, and 21 months, it was found that 20 of the men in the intervention group contracted HIV, whereas 49 of the men in the control group contracted HIV. This corresponds to a 58% relative risk reduction in the intervention group. Randomized control trials conducted 2 years later in Uganda and Kenya found similar results, with a relative risk reduction of 50% in the Ugandan study and a relative risk reduction of 53% in the Kenyan study.
So, what's the issue? It appears these African epidemiological studies support the hypothesis that circumcision prevents the transmission of HIV. Well, let's look closer at the science. Recall the theory that HIV enters the body through the mucosa of the inner foreskin because of the thin keratin layers and presence of Langerhans cells. A study published in 2007 in the journal Nature challenges this theory. Researchers sought to determine the role of Langerhans cells in HIV transmission. After infecting T cells with HIV in the presence of different dendritic cell types, researchers observed a significant inhibition of HIV transmission in the subset with Langerhans cells. Moreover, after pulsing dendritic cells with HIV, Langerhans cells displayed nearly total infection prevention. Why did Langerhans cells prevent HIV infection? Langerhans cells produce a protein called langerin, a compound that captures and degrades HIV. Accordingly, after blocking the production of langerin in one subset of Langerhans cells, researchers observed high infection rates. This shows that excising the foreskin removes numerous Langerhans cells, which produce langerin, the body's natural biochemical defense against HIV.
But if the foreskin contains an immunological barrier to HIV, then why did the 3 African randomized control trials suggest that circumcision reduces HIV transmission? The methodologies of the African randomized control trials were critically flawed. The trials had high dropout rates, the intervention groups had 4 to 6 weeks of sexual inactivity while their circumcisions healed, HIV was transmitted sexually and non-sexually, adverse events following circumcision, such as bleeding and infection, occurred more than HIV incidents, and, most glaringly, intervention groups were provided with condoms and sexual health services and education at their clinical follow-up sessions. Even granting the results of these studies, the reduction rates of 50 to 60% are only relative. These values are calculated by subtracting the quotient of the percentage incidences of HIV in the control and intervention groups from 1. This calculation yields large percentages despite the small overall HIV incidence in each group. The absolute risk reductions, calculated from the difference of the percentage incidences of HIV in the control and intervention groups, are much smaller. The absolute risk reductions reveal the independent efficacy of the intervention. Based on the results of the 3 trials, between 55 and 112 circumcisions would be required to prevent just 1 case of HIV.
Furthermore, there was a 4th randomized controlled trial in Uganda that studied the effect of male circumcision on male-to-female HIV transmission. HIV-positive men were randomly assigned to either the control or the intervention group, and the HIV acquisition of their female partners was tracked for the next 24 months. At the end, 8 women in the control group, or 12% of the total number of women in the group, contracted HIV, whereas 17 women in the intervention group, or 18% of the total number of women in the group, contracted HIV. Contrary to the other studies, this trial found a 35% relative risk increase with 1 additional case of HIV for every 15 circumcisions performed. After the experiment backfired with these results, the study was terminated early and the findings were disregarded in future circumcision policymaking. Finally, a 2021 cohort study of nearly 570,000 Canadian men found no significant difference in HIV risk across circumcised and uncircumcised men.
Despite the questionable science underlying circumcision and HIV, the WHO, UN AIDS, and PEPFAR rolled out a mass voluntary circumcision campaign in the most HIV-burdened regions of Africa. As of September 1st, 2018, the program resulted in over 15 million circumcisions, with 45% of patients under the age of 15. This age statistic is alarming, considering the program was billed as voluntary, implying that patients were of the legal age of consent. But, desperate for funding, many African communities circumcised their unwitting children to meet the circumcision quotas, sometimes even without parental consent.
If nothing else, the African circumcision campaign misdirects resources. The time and money allocated to circumcisions could be utilized on known and effective preventatives and treatments, such as condoms and antiretroviral drugs. Beyond a financial viewpoint, there are millions of real people that are being affected by this bad science. African boys and men have rights to informed consent, accurate medical information, and efficacious treatment. The circumcision propaganda, misleading health claims, and invasiveness of circumcision all violate these rights. A growing number of African men are speaking out against the circumcision campaign, viewing it as an attempt to control their masculinity and suppress their autonomy. This program will have catastrophic effects on the credibility of Western medicine in developing regions in the decades to come.
Unfortunately, this is not just an issue affecting men in some faraway country. Circumcision became popular in the Victorian era with the eugenics movement. While most of the Western world has since abandoned the practice, infant circumcision is still very common in the United States. Medical misinformation, such as claims of reduced HIV transmission, often lead healthcare practitioners to solicit circumcision and, in turn, parents to choose circumcision for their sons. In reality, the foreskin is a highly functional and erogenous component of the penis, whereas circumcision is painful, damaging, and unnecessary. Ultimately, to uphold the patient's best interests, circumcision should be a last resort after more conservative measures have been exhausted. There are less risky and more efficient methods of tackling HIV transmission than cutting off healthy body parts.
Use a condom to prevent new HIV infections, not circumcision. Apparently that has been misleading people. The message that goes out there about male circumcision is like when you are circumcised, then there is no HIV infection. But that is wrong. That's the right message.